Okay, our first guest is Dr. George Hu. George is the Chief of Mental Health at Pudong Shanghai Family United Hospital and also the President of the Shanghai International Mental Health Association. Did I get that right? Okay, perfect. George, thank you so much for joining us. Do you mind kind of just introducing yourself a little bit and telling us about what you do?
Sure. I am a clinical psychologist. I'm from the States. I'm a licensed psychologist in California and Hawaii. And my family and I, my wife and two kids, two boys, have been living here in China since 2013, so over 7 years now, in Beijing and Shanghai. And, like Stephen said, I'm the chief of mental health at United Family Pudong Hospital, where I have a department consisting of psychologists and psychiatrists, and we do a bunch of mental health work, including individual and couple psychotherapy, assessment services. I'm also the president of the Shanghai International Mental Health Association, and so we do a lot of mental health work really all around the country, especially in this kind of coronavirus pandemic situation. We've been doing a lot of online work with different people in many cities actually around China and also around the world. And I work with, Chinese people. I work with international people. I speak both English and Chinese and what they call an ABC. So I, was born and raised in California, but I'm of Chinese descent and I speak Chinese. And so I work mostly actually with the Chinese speaking population here. Yeah.
Oh, awesome.
What
Okay,
we also
awesome.
do is we also equip and train lay staff in the churches to meet the mental health needs of their congregations.
Mm-hmm. Awesome.
Really cool. I think there's a lot that we could talk about. Are you kind of specifically, how has your work been impacted by the pandemic, if at all?
Well, it's hard to say because we're pretty busy. I will say, though, that since the pandemic happened, we've been doing a lot more online services. Just because people, maybe have various degrees of comfort coming into a hospital, or they live in Wuhan, or they live in some other area where they need an online platform to access services, or they've been evacuated out to different places, different countries around the world, and they need services. So we've been doing a lot more online services, but man, mental health here, and we can talk about this later, is a limited commodity. So, my schedule is booked. My first appointment, right now, today's May 1st out here in China. My first available appointment is May 28th. So
Wow.
it's a pretty, it's pretty busy for us.
Wow.
Yeah.
How do you kind of get people to get past that cultural stigma or that sense of shame of, hey, I need help with this?
I try to help in my work. I view the majority of my work in helping people separate truth from lie, right?
Mm-hmm.
And like Jesus promised, right, the truth will always set you free, right? In the end, it's your friend and it's going to set you free. Although it's hard to swallow, it could be painful, it could bring you through the valley of the shadow of death, but it is going to set you free. He promised that. So we have to separate truth from lie, and we should always walk toward truth, right? And so part of the lie, I think, is that if people are experiencing mental health difficulties, that lie, part of the lie that there's something wrong with you, right? Like that's worse than if you had a flu, or if you had cancer even, right? For which of course you would go and seek help and you would try to find a professional and you would go to a doctor or whatever. But if you have a mental health issue, no, see, that's different. That's like something real wrong with you. You're crazy. You're extra sinful. God is punishing you. Like there's all sorts of lies, right? There's all kinds of lies that people believe about it. And that lie sometimes can prevent them from seeking help. The lie can start to infect communities around them, right? And deteriorate those communities, whether that community is a family, a church, a school, whatever, right? And it's a lie. And part of what I help people to do is kind of deconstruct that lie and say, no, the truth is probably that you're experiencing, right, a mental health challenge, right? And if we're able to accept that, if we're able to swallow that, then there's help for you and for us. And another part of that lie, and a very important part of that lie, is if I'm experiencing a mental health challenge, I'm the only one, right? Or I'm that rare psycho breed or something, right? But in reality, you're not, right? Studies show, at least in the States, that most people have met criteria for a mental health challenge, right? A mental health disorder in the United States of some sort. Most people, right? We don't say that of cancer, we don't say that of emphysema, asthma, whatever, right? Like, we don't say that. Another part of the lie is if there's something wrong with like the organ that's inside your head, that's something fundamentally different from the organ that's inside your chest, right? Or the organ, and that's a lie, right? That's I don't know where it came from. It's made up, right? It's not from the Bible. It's not from God, right? It's from somebody somewhere, and it keeps people from getting help.
Yeah, that's really fascinating. I wish we could talk even more, just kind of at length about kind of, just kind of how do you. Sometimes I wonder, how do you diagnose the difference between what might be, say, a mental health issue versus how do we know that there is or isn't like a spiritual component? Actually, maybe you could, talk about that a little bit. Like, is that something that you've thought about? Like, is there a way to kind of bifurcate or to tell when there is a spiritual component versus a mental component?
I mean, there's a spiritual component, I believe, really to everything, right? But I think what you're asking is, how can somebody separate, oh, this is like a character issue or a sin issue, right? Versus this is a mental health problem, right? And I don't know that the line is that bright. I really don't, right? And the fact that somebody might have a stronghold, right, that keeps them from repentance or keeps them from going to God or something like that. I mean, is that, it's not so much important why that is. It's more important what we're going to do, like what the goal is for that person, right? And how can we move them along that goal, right? If their goal is, hey, I want to get over this issue so that I can move on with my life, so I can move on with my relationship with God, so I can move on with my relationship with my wife or my church or whoever, right? Then, it's not as important what we call it, like potato. It's more important what we're going to do about it and how we're going to move you forward,
Yeah.